Good morning. Welcome to the Los Angeles World Affairs Council and Town Hall. I'm Kim McCleary, President and CEO, and it's my great pleasure to welcome you all to today's program. For those of you who would like to submit questions to our moderator and panelists, there's a control panel on the right-hand side of your screen where you can type in your questions. Rachel Kenderdine, our membership manager, will be managing your questions during the Q&A portion of today's program, which will start in about 30 or 35 minutes. And please stay tuned to the end of the program and I'll give you a brief update on some terrific upcoming in-person and live stream programming. In recent years, homelessness has permeated every subset of LA's population. From the elderly to students, homelessness has impacted the lives of hundreds of thousands of people, and women have been no exception. This morning's program will focus much needed attention and support on the unique circumstances of female homelessness. We've brought together a knowledgeable panel to talk about the landscape of homelessness and legislation directed at specific subsets of the population. We are pleased to welcome today's moderator, Maryam Zar, a writer, editor, and former correspondent. She will be talking today with LA mayoral candidate Craig Grieve, with Nan Roman, the CEO of the National Alliance to End Homelessness in Washington, D.C., and Amy Turk, Chief Executive Officer of the LA Downtown Women's Center. Maryam, it's time for me to bring you and these wonderful panelists online so that we can get right into this discussion. Thank you all so much for joining us today.
Thank you, Kim. Thank you, LA World Affairs Council and Town Hall, for once again allowing me to moderate an issue that is of great interest and importance to me. I'm glad today to be able to bring these three panelists to your membership, to the LA World Affairs Council membership. Amy Turk is someone I've known for years, even before she was at the Downtown Women's Center. I volunteered at some point for female homelessness, met her then, and I'm familiar with the amazing work she does. I have only recently become familiar with Nan. I wish I had met her sooner, but the National Alliance to End Homelessness is a national organization in Washington, D.C., and I am eager to hear from Nan how it looks from her standpoint as she looks across the entire landscape of homelessness, because here in LA, we at least feel like we're the epicenter of it all. So it'll be interesting to get your perspective as well. Thank you for joining us. And Greg Grieve, who is running for mayor, not an easy task in this round. It's quite a field this time around. But also you bring in a particular perspective to that mayoral candidate run, or the candidates, because you are a member of the LGBT community. And so when you look at homelessness as you sort of consider becoming the mayor and solving this biggest of all problems, I'm sure you see it in a different way than the other mayoral candidates do. So it'll be interesting to get your perspective. So I want to jump right into the conversation, but I want to preface it by letting you all know that the reason we convene this is because there's a Senate bill making its way through the California legislature. It's SB 419. 914, I'm sorry, it's SB 914. It was brought to my attention by Amy in the Downtown Women's Center. We reached out to Senator Susan Rubio, who's actually the author and sponsor of that bill. And while she really did want to join us today, she couldn't fit it in her schedule. They tried, they gave us a couple of false starts, but she did send us a statement. So I want to read that statement to everybody and sort of frame our conversation this way, because she is the author of this bill, and this bill is making its way through the California legislature. As I said, it's already been through committee. Then it went to the floor. It passed on the floor of the Senate. It's now in the Appropriations Committee, which meets just this morning. They actually might be talking about it just as we are. Amy, if you get a text on your phone that lets you know this passed, let us know. Okay, so Senator Rubio says, I authored the HELP Act, and the acronym is HELP, H-E-L-P, because in 2020, the Los Angeles point in time count found that 49% of unsheltered women and 67% of unsheltered transgender individuals report experiencing domestic violence. These survivors sometimes have to make a choice between staying in an abusive relationship and being assaulted or becoming homeless. That's not really a choice. Despite these statistics, domestic violence services have been grossly underfunded. We must ensure that we're inclusive of the unique needs and experiences of domestic violence survivors and other unaccompanied women experiencing homelessness. The HELP Act will accomplish this by requiring that the California Interagency Council on Homelessness sets measurable goals to address the unique needs and experiences of vulnerable populations, and will also embed a focus on these vulnerable populations in local government homelessness responses. So my first question goes to Amy. Amy, you and I mean, you're there all the time. I happen to be a commissioner on the status of on the LA City Commission on the Status of Women at the time. I showed up at a CES Policy Council meeting about 5 years ago because we were advocating that the state designate women as a vulnerable population of homelessness, experiencing homelessness. As I recall, that year, the city declined, or the county declined to do that. You've advised me that they since have, I believe in 2020, they designated women as a vulnerable subset of the homeless population. Tell me what has changed through these years to make it so that there's actually a bill now passing through the state legislature focused in this way on the specific needs of women and transgender communities.
Thanks, Maria. It's nice to be together with you all. I mean, Nan can speak to the strategies much better than me, but for 10 plus years now, there's sort of been a strategy among homeless services that if you call out a specific subpopulation, then you tailor strategies and evidence-based practices to that population. Resources come to decrease homelessness in that population, and accountability to see the results through happening, then you see decreases. So we've seen this in national efforts around veterans, families, what's called chronically homeless, and youth. And I can get into later how women, specifically unaccompanied women, fall out of those categories for various reasons. And for that reason, Miriam, you've heard us at the Downtown Women's Center really advocate for that population in particular. And like you said, the LA City Council and then subsequently the LA County Board of Supervisors did designate unaccompanied women as a unique population. And that gave us the momentum to find Senator Susan Rubio to champion our bill that you've mentioned, 914.
So just quickly, just to follow up, so Senator Kamlagar, who's actually a state senator not far from where I live, is also championing this bill. I wonder if it's made a difference that there are more women in the state legislature, more women being elected, and maybe even more women who've had some experience down on the ground, you know, across LA County, you know, watching, not experiencing necessarily, but seeing homeless women. Does that help? Does that level of advocacy up there help versus 7 years ago when there really wasn't much?
Yeah, I think that's a logical conclusion. Our LA County Board of Supervisors is 5 women. The city council president is a woman who is very concerned about domestic violence and women's issues. And, you know, I think people are just understanding that the prevalence, that domestic violence is one of the main drivers for women experiencing homelessness, and that women, now that we have a little bit of data because of these advocacy efforts on unaccompanied women, we see that they actually make up more than veterans and youth combined, and more than families. And let me be clear, all populations are really important, but, you know, obviously we're trying to make the argument of who has sort of been excluded from housing resources in the past because of how we allocate our resources.
So if this bill passes through the California legislature and gets signed, will organizations like yours actually be able to get more money? Is that what will happen? I mean, it translates into attention, but also resources on the ground?
It has locally, because we've shown through our, you know, we've had years of community-based research expressing the voice of the needs of the women. Now that we have more data to back it up, we've been able to advocate for more financial resources. This particular bill is not a financial ask.
Right.
It is an ask of, you know, cities, counties, continuums of care to look at their data and set goals for these populations.
Okay, so I'm going to read you a quote from Senator Kamlagar, who also sent us something to be able to frame our conversation, and then I'm going to ask Nan Roman to tell me what it looks like across the country. So Senator Kamlagar says, I'm proud to support the HELP Act to reduce gender bias in our state's response to homelessness crises. We know that women are uniquely affected by all systems. As a result, our solutions need to be equally unique. SB 914, therefore, is an integral part of my advocacy for economic justice throughout California. Not only will the passage of this bill increase equity, it will ensure that we are supporting our population of unhoused women and survivors of domestic violence with the care and dignity they so greatly deserve. So, Nan, I'm going to ask you to look across the United States and tell me what it looks like for women as you look at the intractable issue of homelessness, probably across all 50 states. But one more time, I just want to highlight this idea that lawmakers make a difference, right? Who sits in those chairs of advocacy makes a difference. And I think that we're seeing a trend of, you know, sort of younger people with different ideas getting into those elected seats, those positions of advocacy. And that's what's really shifting our ability to make laws that impact, you know, our most vulnerable populations all across the states. Is that what it looks like to you? And how are women faring across all 50 states? Yeah.
Sorry.
Thank you.
I'm not sure that I feel that that we have a lot more women who are advocating for women in the homelessness, with women who are experiencing homelessness, to be honest with you, nationally or in Congress. It's not that women don't support it in Congress, they generally do, but there hasn't been I haven't seen a big change that I would attribute to that. Women on their own are almost a third of homeless individuals in the country, so people not living in families or not homeless with their families. That's about 120,000 women at a point in time. One little bit of slightly good news is that women on their own get more than their equal share of shelter beds. But they're 29% of the population, but they're nearly half. They get nearly half of the shelter beds. So there's some understanding that women have unique needs, experiences, vulnerabilities, and definitely that they need to be inside. But the majority of women who are on their own are still unsheltered. And the majority of individuals actually are currently unsheltered. There are more unsheltered individuals than there are sheltered individuals. Over half, 55% of women who are homeless on their own are unsheltered, so they're not even in a shelter bed. And that certainly puts them at tremendous risk of violence, more so than men. The homeless system, though, has very little capacity to rehouse individuals who experience homelessness. So there's basically, you know, nearly half of people who are homeless are unsheltered altogether. So the system is too small for the problem. It can, at most, the homeless system can house 9% of the people who experience homelessness every year. That's the level at which we're performing now. Most people who become homeless, the majority of people, including women who become homeless, exit homelessness on their own without any kind of subsidy for housing or anything else. Otherwise, we would have obviously a lot more people living on the street. The homeless system, as I said, too, can only shelter half of the people that come to it. So it's not a robust system that's helping everybody or can attend to subpopulations very well. Although the point you made earlier about concentrating on subpopulations is correct, I think. It's also not, in general, a very good system in terms of delivering services, Downtown Women's Center being one of the exceptions, and there are many exceptions. But on the whole, most shelters are not doing a lot of service delivery. DV programs tend to do better on the service delivery side. You asked me also, I think, about states. States get a lot of federal DV funding, and they obviously use that to help a lot of people who are unsheltered or living in shelters. And they focus more, I think, on services when they get funded through some of those domestic violence funding sources. In short, I think the homeless system does need to do a better job, but it's probably not going to be able to solve the DV problem or house all the women that go into it the way it's structured now.
So those were interesting statistics. Just a couple of follow-ups. So you said that first of all, that in and of itself is an alarming statistic, that 30% of the homeless population is unhoused women. That's pretty high. So you're saying that even though they represent 30% of the homeless population, 50% of beds are allocated to them. That's a national picture, right?
Right. Yes. That's
And you can speak to this, but here in LA, I do believe we have a shortage of shelter beds, right? So there are places where there are more shelter beds than they need, and then in LA we have a dire shortage. Is that correct?
There are not very many places that have more shelter beds than they need.
Sadly.
I mean, basically, there are not enough shelter beds for all the people that need them. There are reasons why there are reasons why shelter beds are sometimes unused, and particularly, we don't need to go into the details of this, but particularly around COVID, this has been a case because people have been moved into hotel and motel rooms, and so room key and home key you have there to move some people out. But generally speaking, the system is that, the homeless system can only really help about half of the people who experience homelessness to any great extent.
Right, and I was going to kind of draw attention to that. Shelter beds are temporary, as far as I understand. There's a finite amount of time that you can occupy a shelter bed. So if you're a woman experiencing homelessness, or even on the cusp of experiencing homelessness because maybe you have experienced some abuse and are now getting ready to leave an abusive relationship, it isn't quick. As you were saying, only 9% of the population can be housed. That transition to housing is not very quick, and I doubt that shelter beds provide a complete bridge. Do they, Amy? I mean, in LA, can shelters house a woman until she's found housing?
It's not always that straight of a trajectory.
Yeah.
And, ideally, that's the point of a shelter, is to move quickly into permanent housing. But we know with the lack of permanent affordable housing in particular, that compromises the outcomes of a shelter.
Okay, so Greg, we're moving on to you. I want you to tell me what homelessness looks like as a mayoral candidate. But before you became a mayoral candidate, you started a volunteer corps where your belief was that if Angelenos could come together and address some of the biggest issues they see in their neighborhoods, they can find solutions from the ground in a better way than government can. And we've spent the last 15 minutes or so talking about the lack of resources and the lack of systems to really be able to solve homelessness at the government level. So as you advocate across various districts in the city, for your mayoral run, what do you tell them about homelessness? I mean, realistically, what do you say that people, Angelenos, can do to impact the homeless crisis?
I think the number one thing that Angelenos can do is understand the truth and hold accountability for those who are running for office. And that's where, when I started Rise Together, which was a grassroots organization focused, as you mentioned, on common ground and common sense, it wasn't just let's sign up some members. It was let's educate the public. Let's be out there bringing the reality of the situation here. And I think it's really easy for people to feel overwhelmed by the homeless crisis, right? Like, it's really easy to go, oh my gosh, I don't even know where and how and what to begin. But it's also, what I find is that there is a way out of that overwhelmness to empowerment towards elected officials that are going to make the right decisions, right? Like, there are dozens of programs, Amy's being one of them, that are doing incredible work. And then there are dozens of programs that are not. And the ones that are not are generally more closely tied into government and government resources and the lack of accountability there. But there's just a general misunderstanding of of what's going on with the homelessness situation in Los Angeles, right? Like, when I talk to people out on the campaign trail, and I talk about the fact that we don't have a real-time data system in Los Angeles, right? Like, one of the things that this bill calls for is this data and accountability. We should have that for every single individual that takes into account every single population. You can't solve a problem you don't understand. And people are shocked and appalled that with the billions of dollars that we spent, that nobody has put together that system, in the same way that they're shocked and appalled that if I go out there, I ask this question every single time I do a town hall. I ask people, if you were going to become homeless tomorrow and you needed to call someone in the city for help, who would you call? No one has an answer to that. And the fact that we're not scooping people up, that there's not a system that reaches people on the verge of homelessness or when they're about to experience homelessness and pulls them into the ability to keep them housed, to keep them off the streets, to keep them into a resourced system, is a huge fall down. And we know that from the cities that are making progress, right? There are cities across America that are making real and substantial progress across homelessness. As you know, I'm a huge fan of Community Solutions, the nonprofit, national nonprofit that's working with 98 cities to move to functional zero homelessness. There is a path to functional zero homelessness. It involves the dedicated attention to these populations, the real-time data, what's necessary in support, effective spending. What I hear from people is that they are shocked to know that there are cities that are making progress. They're shocked to know that there is no real-time data. They are shocked to know that there is no system of resourcing for those that is widely known and aware. And that's where I think these vulnerable populations suffer the most, whether, female populations and trans individuals in the LGBT community and different marginalized communities suffer the most, because when we fall down as a society, they always suffer the most, right? Like in whatever crisis we have, they are suffering the most. And so that's what I hear, is that people are shocked and appalled because they don't actually understand what is being done on a local level and what is not being done on a local level, and the gap that private organizations have to pick up and make.
Okay, well, on an interesting note, I just read this morning in the LA Times that the LA County Board of Supervisors voted on Tuesday to create a new office, I guess last week, to create a new office or department that would coordinate the county's response to homelessness across the region. Amy, have you heard about this? I mean, I got the impression that this was yet another department that was going to try to outdo LAHSA and bring all things together and do exactly what Craig says, which is, coordinate everything. Tough task, but is the county embarking on yet another impossible task?
So, taking steps to what would get us to ideally more coordination. To Craig's point, why real-time data exists. It's siloed and takes a while to analyze and make sense of. And thankfully, at least from Downtown Women's Center's opinion, there is a strong department called the Homeless Initiative in our county. Our stance is that should be elevated, given what we feel is their effectiveness on this, and given the authority to help coordinate with the city and with our local continuum of care and providers.
Okay. And Nan, when you look across all the states, where is there a successful response to homelessness?
Well, I mean, I think generally it's not really a state issue. It's generally, except maybe in California. I mean, in most places, it's really a city issue, a local issue. It's not that the states don't do anything, but it's generally not seen as a big state responsibility. And you also see the places, to be honest, looking at California compared to other states, that places that are colder, that built up a lot of shelter early on and now have capacity there. Those are places that are making more progress. One of the things that's just a huge challenge for you in California is that there was practically no shelter infrastructure built for decades, and now you have this enormous gap. Such a very small percentage of people in Los Angeles, for example, are in shelter. That you can't house them all, and you can't spend all your money on shelter. No one wants to spend all their money on shelter to get everybody into shelter. So you're kind of in a pickle, honestly, relative to other states. Minnesota is doing a good job. DC, where I live, actually saw a big reduction in homelessness this year. New York has a right to shelter, so they don't house that many people, but they also don't have, they have a lot, pretty much everybody is in shelter. Massachusetts generally does a good job. The smaller Rhode Island, New England states do. So there's progress going on around the country in various communities. There's some communities in Texas that are doing a good job.
So I want to suggest that if and impossible, I know it's impossible in LA, but I want to suggest that if every community breaks homelessness down into smaller subsets, maybe it's more tackleable. So Craig, I'm going to go back for a second to your Rise Together initiative, and I'm going to share with you an anecdote. Where I live, which is a little town in Los Angeles, it's called Pacific Palisades. We had not a huge homeless population, but a noticeable homeless population. And what we did was that the community came together, found a community. I spearheaded that. It was a few years ago. It's actually still going and it's going well. But we found a community solution. We sort of looked at who we are, where we are, who our residents are, what they're willing to do, what some of the solutions might be. You know, the state helped us, our city council member helped us, frankly, our chief of police helped us. And we sort of came up with this. Various stakeholders will do what they can, identify the problem and solved it, but solved it in a very small way, right? Our little community. You know, what Nan is saying is that across the country, it's really not a state issue. You know, little communities are solving their own things. So you walk around the city of LA and you talk about, hey, you know, Rise LA, let's get, you know, let's all put our hands together, roll up our sleeves and solve LA's problems. What about that idea that we look at homelessness not as this huge problem, but subsets, maybe women, LGBT, youth, as Amy said, and then, you know, look at small communities or neighborhoods in smaller ways, you know, group them in ways that they can be common or compatible, and then tackle homelessness that way and bring people into the tent versus always looking at government to fix.
Well, yeah, I think for the communities that are able to step forward in the way that the Palisades did, I think you can find effective solutions that move forward. I think understanding who's homeless and what they need is the first step, right? And so breaking them down into the subpopulations, I think it's my least favorite thing in the world whenever I go out on the trail and somebody's like, well, doesn't everyone have mental illness and addiction? And my response is, we don't even know who's homeless or how many homeless individuals there are, except through a random point in time count, which is a glorified game of duck, duck, goose, right? Like the reality is, like, until we know real-time data, we can't solve for those things like mental health and addiction. We can't solve for individual needs of individual populations, and particularly those suffering from domestic violence and or most vulnerable. So yes, breaking things down into the groups, real-time understanding who those are, is going to move us forward. The challenge becomes that the Palisades is a community that had a much higher resourcing level than other communities throughout the city. And so then we're looking at how do we empower, how do we look at community activation, for example, in South LA. You know, I was down at 59th and Figueroa Place the other day, and that's a community where no one has the emotional or financial or intellectual bandwidth to focus on what a community-led solution would look like. And then so you end up with people who can move forward in their communities, and then you end up with a whole lot of communities that don't have that. I think the issue is, can we find groups like Amy's or groups like the Hollywood Presbyterian Church or other groups that are doing that effectively and doing it cost effectively, and scale them, and they can operate in interaction with communities. But I'm a big fan of the fact that government in LA, at least, has shown for the last 10 years that it doesn't know what it's doing when it's coming to solving homelessness. Like, the problem doesn't keep getting bigger as you spend $8 billion if you're spending money in the right place. I'm a big fan of us pulling out of those components and pushing that money towards groups that have a demonstrated track record of solving this. So in a way, it's what you're talking about, is that community-driven solution, but it's I would say community organizational-driven solution where we see clear accountability, clear results, and effectiveness, and that we're supporting the people who are driving those solutions.
Yeah. Point well taken. And I don't think that every community solution can be transferred to another community, but I do agree that if you ask people to find their own solutions or think of ways where they think they can address problems in their own communities, you end up with better suggestions. So Amy,
yep.
This point in time count that we keep talking about. So in Los Angeles, for anybody who doesn't know, once a year, I believe it's January 2nd, volunteers fan out across LA County, and they literally count homeless people. So we do it in the wee hours of the morning, if I'm not mistaken. And so, you know, presumably it's when people are sleeping, bedded down. And so people go across LA and they literally will plot homeless people on a map. The communities do it separately. There are separate spas, right? SBAs. And so that is how the county informs itself about homelessness. How effective it is or is not remains for other people to debate. But Amy, I want to ask you, SB 914 would require this California Interagency Council on Homelessness to set and measure progress towards goals to prevent and end homelessness among domestic violence survivors and their children, among unaccompanied women in California. The bill would further require an initial set of goals to be established by January 1st, 2025, and be reviewed and updated every 2 years. How would this translate on the ground for providers like you in increased resources or even the ability to transition women out of homelessness? So again, I think we're talking about data and data being better. This bill does not give you money. It doesn't give you monetary resources. Presumably it gives you other tools. What would those other tools be?
Yeah, and you know, we use the point in time count to usually get the big number, how many on any given night are experiencing homelessness. But every single day, our staff in homeless services are doing intakes with people and gathering information that's entered into what's called homeless management information system. That data boils up into the state and over to HUD. And there's a lot of, you know, you could pull out by gender, by age. You could say, like, I'm interested in older people and how long they've been homeless. Like, you can do some really interesting analysis with that data that exists. So that's the ask in this bill, is to really focus on, you know, through a gender equity lens, the data that exists. Ideally pull that out and bring your cities and counties together to make data informed decisions that roll into goals and strategies to address those populations. You know, this is a model we could use for all populations, and, you know, have to some degree with like veterans and et cetera that we've been talking about. So that, you know, my hope is to, you know, bring together coalitions of people around the table with cities and counties to say, okay, we have this data. What does that mean? Does that mean we need X number of shelter beds, X number of permanent housing? How do we bring victim service providers to the table more? Because we know that domestic violence is the main driver into homelessness for women. I really look forward to helping gather those meetings, such like Community Solutions does across the nation that Craig brought up.
And in that point in time count, they're not collecting any data, right? That's just a literal plotting of homelessness. So
yeah, there's two components. There's a demographic survey done at the same time as the point in time count. That does get you more information about population, trends, ages, gender, things like that.
Okay. Just on an aside, I know another population group that's growing within homelessness is elderly. Are they a protected population, or are they a vulnerable population in California?
Vulnerable for sure, and there are a number of initiatives focused on older adults.
Okay. Nan, across the country, elder homelessness, is that growing?
Yes, homelessness among older adults is expected to double by 2025, triple by 2030, and then it will go down. That's just a demographic trend. We're all getting older. I mean, the older population. So, but it definitely needs to be attended to, and it really isn't attended to. And I just would reiterate what Amy said. I think, honestly, you may not be making the best use of the data you have in Los Angeles, but you actually have a lot of data. The point in time count is an effort to largely, it counts the beds, which get counted through HMIS too. But it also tries to identify how many unsheltered people you have, which community solutions programs are also not getting every day to every unsheltered person. So it's estimating that there's a whole group that's left off of it, which is people who are doubled up temporarily with others, just because you can't count door to door. Even the census, you know, the decennial census doesn't go door to door trying to count people. So the HMI, there's obviously lots of work that needs to be done, and people need to use their HMIS data more creatively, but HMIS is real-time data. It's administrative data that's collected by every jurisdiction that's a COC in the country. And if you use it and keep track of it, use it to make decisions. It is real-time data, because every time you see somebody, you're entering that into the system. So I just wanted to make that clear. And I think that the use of the data is very important in the legislation, and so is the plan. I think, you know, having a plan for a subpopulation is a really good idea, because everybody doesn't need the same thing. And obviously victims of domestic violence, women on their own, they need something quite different than families or older people or young people. And to have a specific plan about what you're going to do, what kind of housing people need, how much assistance, how many months of rental assistance. The Alliance, for example, several years ago, it wasn't something we invented. We learned about something called rapid rehousing that Minnesota was doing, just saying, why should we keep families in transitional housing for, you know, 3 years at a cost of $75,000 while they're trying to save up $3,000 for deposits on an apartment? Why don't we just give them the $3,000 and let them rent the apartment, and a few months of rent is cheaper. They don't have to, they're not, it's blah, blah, blah. Anyway, that worked, but that wouldn't work for everyone. You know, different strategies for different groups. I think that's what a plan is meant to do. It's a good idea.
So I wanted to bring your attention to family homelessness. I actually wanted to touch on that. Again, family homelessness, a lot of times homeless families are headed by single women. With the discussion of family planning very much on the table as America braces for a Supreme Court decision coming down, I wanted to see if we could have this conversation right now and talk about, you know, women, pregnancy, children, sometimes unplanned. A lot of times, women who are experiencing homelessness, we know have experienced multiple abusive situations or relationships. We know also that these children who either experience homelessness or watch abusive families are adversely impacted. I think statistics show that kids who experience homelessness as children are much more likely to become homeless as adults. So these are tough choices that we're asking women to make without a whole lot of resources on the table for them. How can we help America's homeless families by advocating to focus resources on either them or on the vulnerable women that head those households?
Well, my own view is that the driving cause of homelessness is the lack of affordable housing, and that it's basically a game of musical chairs, and there's not enough housing, there are not enough chairs for everybody, and the people that lose out are people who have, you know, that have mental illness or substance abuse disorders, or families that they can't support. And it's really, once people are back in housing, they may still have a lot of problems, but they're not going to be homeless anymore. That's the driver. And so I think what you see a lot is they're vulnerable parents, vulnerable mothers that stay in abusive relationships because they know they're not going to be able to keep their housing on their own. And of course, also it's true that the stress of poverty and uncertainty around things like paying the rent can result in abusive situations inside the family too. And definitely there's a really simple solution to that. It's just not an easy solution to achieve, and that would be to have a right to housing assistance so that people could afford housing. And I will just say that I think if nothing changes, which there's still some possibilities that some things might happen in Congress with the reconciliation bill, but they're unlikely to get a lot more housing money in there. I think we're going to see an increase in homelessness moving forward, because there typically is such a thing after a recession. And without getting more subsidies, we're going to, unfortunately, I think, see a lot more people entering homelessness. And the other, just one quick thing I want to say about LA is, I think it's not that the system in LA is probably not working very well, but it's also the case that a lot of people are becoming homeless every day. And so it just can't keep up with the inflow. And that's a housing affordability issue.
So Craig, I'm going to come to you on that housing affordability issue. First of all, I'm sure that you walk around all districts across LA, and I'm sure you've spoken to homeless people. I've done a little bit of that. And what I hear over and over, and this is not a commentary on good or bad, just factual. What I hear over and over is that people who occupy space on the sidewalks in Los Angeles do get some resources sent their way. So organizations will come and deliver food. Sanitation will come there. So as Nan says, we have quite a few homeless people in Los Angeles. Because it isn't cold, I assume we have a bigger influx of out-of-state people who maybe come to LA to be homeless. It's not true. Okay, so you'll tell me, Amy, you'll tell me that.
Amy, it's like a popular myth.
What I want to say is, with that influx and the fact that housing is definitely not affordable in Los Angeles, and when you, I'm sure you do, when you go through neighborhoods, it's tough to get all neighborhoods to buy into the idea of bringing affordable housing into their neighborhoods. So you've got that to deal with. I mean, what does that look like when you're, campaigning across Los Angeles and talking about solving homelessness, but the reality is that the solutions are going to be tough to swallow for a whole lot of people?
So I think that's where we
homeless side and side. Okay.
Yeah, I think that was the whole point of creating Rise Together, was finding common ground and finding ways for people to move forward and not creating open warfare in communities, right? This is why I'm not a fan of the elimination of single family home zoning, because I don't believe that it's necessary in order to move us forward and create affordable housing, right? The statistics are very clear in Los Angeles. We have only created 13% of our housing in the last 30 years, which means we don't have enough housing for the people who lived here in 1992, let alone 2022. But we can move forward and create housing, and that impacts everybody, right? So to be very clear, the lack of housing means that if you're looking for an apartment at $1,500 a month, it's $2,500. If you're looking for an apartment at $3,000 a month or home to live, it's $5,000. If you're looking for $5,000, it's $10,000, right? It's all the way up the chain, and that's not to say that we should be sympathetic to those who are looking for a $10,000 a month home. It's to say that the lack of affordability impacts every single citizen and person here, unhoused or housed. And so we have to do two things at once. We have to keep people in their homes while we craft long-term solutions that we move quickly on. The reality is that we can build affordable housing throughout the city with a few key regulatory changes. I've spoken with Dignity Moves and Sola Impact and Diversity Housing Corporation. There are 5 companies alone that have said who do not take government financing to construct affordable housing. They're using private investors, and they're turning a profit over a longer horizon, but they've got investors willing to do that as part of their social good initiatives. I've spoken with 5 companies that collectively could build 60% of the affordable housing that we need in this city within the next 10 years, if the government made just a few key changes in how they approved and moved things forward. The reality is that LA has made it impossible to build anything. And so the only thing that pencils are really expensive units because there's a high profit margin. But if the city actually got out of the way and the city actually said, okay, we're going to greenlight every latent industrial zone for mixed use development with affordable housing. We're going to greenlight higher density along Beverly, Melrose, but preserve the communities behind them. There are a few key changes that if we preserve communities, we preserve neighborhoods and build higher density where it makes common sense, not by saying to every single house you could just rip it apart and put 4 houses there. You can solve that affordability problem, but those are 2 things that have to happen in tandem with each other. We've got to take flight on keeping people in their homes and resourcing for these most vulnerable populations at the same time that we're looking at a 10-year horizon to create an affordable city. That is possible, and everyone is suffering as a result of that. I talked to a woman that we did an Instagram Live, Shadia Kisab, she's got 3 kids and she's looking for a new place to live. And she's like, I want my kids to just be able to play outside, and that's not possible in our neighborhood, that there's no place for me to go, right? And that's a problem.
Thank you. Amy, I'm going to turn it over to you. You can tell me why I'm wrong in my assumption that there's a large inflow of homeless people that comes into LA. I'll be happy to be wrong about that. But I just want to ask you about the beginnings of the Downtown Women's Center, because it was really the inspiration of one woman who kind of just wanted to help, thought she could help, and now it's grown to helping 5,000 women a year. you know, maybe there is a role for people to play. Tell me about the influx of homelessness in LA.
Well, it's not from folks from out of town. Like 15 years of data show that. Most recently, a RAND new study came out, was disseminated through LA Times, and kind of reiterated that. But data point after data point says that people were homeless in the communities that they potentially are living unhoused, or were housed where they are potentially living unhoused. Of course, Skid Row, where Downtown Women's Center is centered, is the exception to that, because it's really, due to policy, the place where all the social services are, where homeless people were supposed to be pushed to, and that's why they have a huge unhoused population in the Skid Row community. But you know, thankfully, because of Jill Halverson, 43 years ago, noticing an influx of women experiencing homelessness, realizing that none of the social services, all the missions in this community were not serving women, started the Downtown Women's Center. So we've really been a women, you know, one woman helping one woman model,
Right.
that's scaled over the years to now helping over 5,000 women.
So I want to say I live in a district where Venice is part of that. You know, I live in a council district in Los Angeles. Venice is part of that council district, and there certainly is an impression, and I've spoken to people, but there's definitely an impression that Venice draws homelessness. Good to know. Here we have made this pronouncement that that is not true. Nan, I've read a little bit about what you've written, and I read that you, at some point you said that you think that homelessness is solvable across the states. But we've spent the last 45 minutes talking about sort of a stronger, a wider inflow of people into homelessness than there is out of homelessness, precisely because there isn't enough affordable housing. It doesn't get built fast enough. Communities don't want to see it in their neighborhoods. Tough to get people out of homelessness. And the longer they stay in homelessness, the more services they need to get out. As you sort of look at the years of experience you've had and what you sort of leave behind as you maybe, you know, move on, what does it look like to be able to solve homelessness? What do communities and lawmakers have to do to break the impasse?
Well, I think you've heard some good suggestions. I will say that when I first started working on affordable housing, which was in the late 70s, there was not widespread homelessness in the country. And because there was a surplus of affordable units, there were more affordable units than there were low-income households that needed them. So if someone lost their housing, you could get them into another place the same day. And there was there were SRO housing. There was somewhere between 1 and 2 million units of single room occupancy housing. There were boarding houses. There was a lot of housing that people like me, so liberal housing advocates, felt was not good enough for people, that got taken down. We lost the SRO units, pretty much all of them. Boarding houses the same. And around about the 1980s, end of the 70s, beginning of the 80s, the numbers turned, and there were fewer units and there were people who needed them. So we're short 7 million units, as I think I may have said before. That's a lot of units nationally. And even if you can produce them, and you can produce them, and I think that Craig, that you made good suggestions about how to do that. And there's if you use federal financing, you're essentially paying market plus to do the development, which makes not very much sense. At the same time, generally speaking, as a rule, if you can't, in order to, even if you're not making a profit, people under 30% of AMI moving into a unit are going to need a voucher to subsidize just the operating costs of the building. So it's definitely possible. I know, because I've lived at a time when we didn't really have homelessness. But we are going to have to, it's getting harder and harder every year. To be honest, we're losing ground, we're not gaining ground on the affordable housing side. And we're getting smarter on homelessness, I think. And it's because we're just more focused on trying to wring as much as we can out of every single dollar, because we're also underfunded in the homeless system. So I think it's getting harder. And if the affordable housing equation doesn't change, no matter how clever we are, it's just not going to work.
There's going to be a lack of housing.
Yeah.
Got it.
Well,
All right, Claire, I'm going to hand it over to you for Q&A, but Craig, that last thought you had, I'm sure you're going to work it into some sort of a response in the Q&A. Claire. Rachel.
Hi. First of all, just wanted to say thank you all so much for being here and for sharing your insights. This has been just a great discussion on the issue, and we really appreciate you all taking the time to come and speak to us in our audience. We have several audience questions, so I'm just going to jump right in. The first one is for Amy and Craig, and feel free, Nan, if you have any insight to chime in as well. What resources are in place for women who suffer domestic abuse in LA if their only choice to leave is to become homeless? How are they protected from their abusers when living on the streets?
The domestic violence services do have a network of hotlines and support, and that's usually how people access the shelter through a domestic violence program. One simple way to find those numbers out is to call 211. Thankfully, there's new funding through HUD and through the Office of Emergency Services, which drips down from Department of Justice money, that pays for a model called Domestic Violence Housing First. And this is kind of like almost a basic income cash assistance program almost, that meets survivors where they're at. Perhaps it could help them literally physically stay where they're at with some cash assistance that would bring some stability and safety. Or like Nan said, it's basically a rapid rehousing program that can help pay for rent and other costs that people need to think about: childcare, transportation to jobs, uniforms for jobs, education that gets you the job. But a more full array of cash assistance is possible through these domestic violence housing first programs.
yeah, I think there's these incredible programs that Amy's talking about. I think the big disconnect that I see and hear from people all across this city is that there are these programs, but the people who need them most are not aware of them, right? Like, how many people in LA are aware, okay, so I'm experiencing domestic violence, my life is in danger, I need a place to live, I should call 211. Like, that logical, we have not, in general, with homelessness resources, with challenges, the people who need these resources most are those who are least likely to know how to even start to find them, how to get on what list, how to go where. Like, the lack of bridging to the public at where they are, the resources can be there, but in general, by and large, the public in Los Angeles that is most in danger of falling into homelessness has the least awareness of the resources and the least resources to actually figure out what's going on. And that's the big gap that we haven't solved for in LA.
Yeah, that's very true.
Thank you. Nan, you've spoken quite a bit about rapid rehousing, and Amy just mentioned it as well as a potential solution. Could you tell us a little bit more about how that works and how it helps reduce homelessness in the long run?
Well, basically, rapid rehousing is a housing subsidy program that's just not permanent. So it depends. I don't know what it looks like in LA. Actually, maybe Amy can say. Sometimes it's a few months. Other places it's several years of rental assistance. And since most people, as I said, since only 9% of people are going to get rehoused by the homeless system anyway, I think rapid rehousing can really help people get back on their feet, and then they generally get employment and are able to pay the rent. Not that many people return. It's also a big program at the Department of Veterans Affairs. It's called Supportive Services for Homeless Families, which is weird because it's neither supportive services nor homeless families. It's actually housing subsidy, rapid rehousing housing subsidies. But they've had tremendous success on that with veterans to really reduce the veteran homeless population. It's not the right thing for everybody. And you have to watch, you have to make sure that people are connected to services and are getting the kind of help they need. And in fact, the Alliance and with other partners, Melville Charitable Trust and others, did a study on critical time intervention, which is a evidence-based method to get people who are leaving institutions. Essentially was first done for people with serious psychiatric disorders leaving hospitals, connected to services in the community, because the homeless system can't provide services for everybody that they house. We just don't have the money. Like if Amy had to provide the services for everybody that exits her program for the next 10 years, you know, you wouldn't be helping anybody new. So there are also some service dimensions, service programs and initiatives that can help there.
Can I just quickly interject, as related to women, and Amy can attest to this. So statistically, women who are assisted to transition out of homelessness manage to stay out of homelessness. So rapid rehousing as applied to women is actually one of the most effective ways to invest rapid rehousing money, because when they do get that 3 months or 6 months or 1 year of assistance and they're helped to either get a job or whatever and get into housing, they tend to stay there. So very good place to put rapid rehousing money with women. Is that statistically true?
Well, it is for downtown women's center, 98% retention rate of folks leave. And I think you're onto something there. I think the basic income models have shown too that, like, you know, women really reinvest in their families and their employment opportunities, and they have.
And I think it's important that we put resources where they're effective, right? Like if you were asked the everyday Angelino, okay, so rapid rehousing has this statistic, and in the meantime, we're greenlighting new permanent supportive housing as a stopgap to our affordability problem that's a bad Band-Aid at $870,000, $970,000 per key. I'm like, can we not? Like, that's my fundamental position. Like, some people will need permanent supportive housing, but in the interim, instead of spending $1 million a unit in construction costs on the Venice Median project, if you put $150 million into rapid rehousing programs for women, your ROI is just much higher, right? And those are common sense decisions that just aren't being made at the city level. And I think that's my big challenge with this, is I want to, like, scream from the rooftops, we should be putting money where it's proven to actually deliver results and to keep people on their feet.
Yeah, but you still need the housing stock.
The sooner the intervention is, right, the quicker you can get somebody out of homelessness and into housing, the less you're going to have to spend on the other side on permanent supportive housing. So generally, spending money on that early end, which is something at least LA hasn't focused much on, is a good investment, because, you know, you get people quicker off the streets. They need less support to stay off the streets.
And it buys you time to build housing for those who need it.
You also have to house people that have been homeless for thousands of days and have disability. You know, it's all a balancing act. And I agree with you that I'm not sure. I think we have a lot of thinking to do on permanent supportive housing, because I'm not so sure permanent supportive housing, I don't know about LA, but is generally also even taking the hardest to serve people. I mean, I think there's a fair amount of creaming going on there as well, and people are staying in it. It's complicated. But I agree, there are things, I totally agree that if we were getting to people faster, especially unsheltered people, it would be making a huge difference in what we were able to do with our resources.
Rachel?
Great. Yeah, thank you all. One final question, and anyone can jump in and answer this one. So we've spoken a lot during this conversation about how the experiences of groups like youth, families, and veterans have changed when legislation is directed to them. So what has that looked like, and how would the HELP Act specifically change what women experiencing homelessness are going through?
I think it brings the accountability to decrease those numbers. So that's exactly what we saw with veterans in particular. When you had federal initiatives that led down, that was accountability. I mean, I was getting calls from the feds on our veterans numbers, like right and left. So much accountability when that was a really important initiative, which thankfully has come back under the administration now. So yeah, just the awareness, the accountability, the setting goals, hopefully will lead to decreases in homelessness in these populations.
Great. Okay. I just want to thank you all again, and I'll go ahead and bring Kim back on, and she'll wrap up for us.
Thank you, everyone. This was such an inspiring and in many ways hopeful conversation. I've asked Claire to work with each of these phenomenal panelists as well as you, Marianne, and we will provide, get resources and reference materials so that we can send it out in our follow-up email. So for those of our viewers who want to learn more and get great facts and statistics, we'll be sending that out to them. So thank you so much for your time today.
Our pleasure. Thank you, Kim, for having us. And I want to say
Thank
your
you so
members
much.
have a lot of great ideas about homelessness, so they can circulate them to the mayoral candidates.
Thank you so much. Thank you, Miriam. For our audience, thank you. For our audiences, please join us again this Wednesday when we host author Gideon Rockman from the Financial Times. And this is related to our series on Russia and Ukraine. And then on May 12th, we have a live stream focused on saving democracy or undermining it, the Senate's decisive role. May 20th, a timely perspective on our nation's security with Admiral Phil Davidson. This is an in-person, member-only roundtable discussion at the California Club. So check out our website, register today. We have a lot of terrific in-person and live stream programs coming up. Everyone stay safe, take care, and thank you so much.